Hi everybody, this is Annie with Unbreakable Strength Co. Today I wanted to talk a little bit just about the conceptual framework for client programming or developing an intelligent road to progress that I use in my approach to training clients. Just a really brief kind of overview here, nothing super detailed, but just trying to lay out a format and an understanding so that you can know how we approach things. So in order to begin the client programming progress, we have to start with an assessment. So in order to establish a baseline, we want to do a series of things. We want to take some table tests. We'll look at observable motor competencies, kind of seeing just at a really first look how well the client can execute things. We'll look at fundamental strength levels, and we'll use this as an opportunity also to kind of build confidence and reinforce an enjoyment and a buy-in into the training process. So to start out with, table tests are just a way for us to kind of look at the skeletal system of the client. They let us know if they have access to normative ranges of joint motion, if they have internal rotation, external rotation, flexion, extension, etc. The next thing that we do is we look at how they move without really any major coaching input. So most people have exercised at some point in their life. Most people have done a squat or a push-up. And so personally, in my approach, I like to kind of see how the client does these things without extra input first, so that we can kind of see what they're naturally inclined to do before we apply kind of any type of cueing or any type of movement changes to what they do. So kind of have to know where we are to know where we're going. Next, we'll look at fundamental strength levels, so taking a baseline strength assessment of these primary movement patterns, so things like goblet squats, push-ups, very simple progressible exercises that we can start someone off at kind of, the very kind of low challenge end of the scale or the very high challenge end of the scale, depending on where this individual is. So kind of finding when there's a visible decrement to their ability to execute the exercise well, and that's going to be the upper threshold for our kind of introductory programming. This is just a reminder that this is not an opportunity to pathologize the client. I think it's fairly common, in particular now in the functional movement world, to diagnose people with things like quad dominance or trap dominance or dead butt, things that have no real kind of major literature support, and things that also make people feel sick or injured or incapable. I think when we encourage pathologizing the client, or when we encourage a sense that perhaps they have something wrong with them, we really disempower them and ultimately make them fearful of getting hurt throughout the training progress. So I think that if we can prevent people from feeling fragile and encourage them to feel anti-fragile, then we have a better chance at really establishing long-term progress. The next thing that we have to do from that assessment is determine priorities. So what was the client competent in? What were they incompetent in? And what is the entry point which will build their competency and improve their incompetencies without over-challenging them or under-challenging them? For example, it could be that, someone is good enough at push-ups that push-ups from the floor feel too easy for them, but that full-length push-ups or that push-ups from their knees rather feel too easy for them, but that full-length push-ups from the feet on the floor are too challenging to them for them to really progress. So maybe we elevate them in a rack, maybe we elevate them on the bench with their feet straight out, or perhaps we, do some type of incline push-up if they're at home, like on their stairs, to make the full-length toe-to-hand push-up easier, but not so easy as to be like from the knees on the ground. It's also important that we determine priorities based on what the client wants. So oftentimes clients are not training experts. They don't know what they don't know, and they don't need to become training experts or coaches themselves in order to make good goals for themselves, but sometimes they need a little bit of guidance. So for example, someone that plays a very particular sport may have a training goal that they think will improve their ability to perform at their sport, but that perhaps there's something else that we could do to improve that goal further. So, for example, say we have, a basketball player and they're like, well, I think if I have bigger quads, I'll jump higher. And it's like, well, they may be pursuing the aesthetic or the size component as a demarcation that it will improve their game. Maybe we as professionals can explain to them that there's, plyometric drills, speed drills, rate of force development things that we can do that will make their quads bigger, probably give them an aesthetic boost, but that will also more ensure that we have carryover to basketball or to whatever their particular goal is. The important thing here to remember is that assessment is an ongoing process. So we want to test and retest our interventions, and we want things that are very replicable and very easy to test without an excessive amount of drain on training time, expense, tech, or kind of, bother for the client themselves. You'll have to forgive me, my dogs are barking. So some things that I'll use depending on the individual client, would be reactive strength index, 1 rep max, resting heart rate. We can test their power output if you have something like a force plate, a med ball throw for distance, say a med ball chest pass for distance for a boxer. We can do VO2 or lactate threshold testing, and while there are direct laboratory test versions of these, there's also tests that are designed to work in the field and in the gym. We may do repeat power tests or maximum reps with bodyweight exercises, in particular if somebody competes in a weight-restricted sport, so something like wrestling or powerlifting or jiu-jitsu, things like that. So it's important to have an interval of time at which you'll test and retest, say every 6 weeks, every 8 weeks, every 12 weeks, whatever it is, and however long your intervention is. You want to make sure that you're progressing a variable, or that if you're training some type of stimulus that may take away from a variable, that you keep it within the range that you need it for peak performance for the individual. Something to remember is that the body is plastic. The current state of tissue and nervous system are living and malleable structures which will model themselves according to the training stimulus applied. If we don't apply enough stimulus, then we'll have a failure to elicit adaptation and the client won't see progress. If we have too much stimulus, we'll overstress the system. Perhaps we risk overloading a tissue and causing injury, or we risk burning the client out by exceeding their recovery capacities on a consistent basis. Quality training aims to deliver the minimum effective dose of stimulus required to elicit positive adaptation, and we want to capitalize on the plastic nature of the body's ability to respond and adapt to stress. As coaches, it's important that we know that the stimulus that we're providing is likely neurological, tissue-oriented, or metabolic-oriented, or most often somewhere as a blend of the three. We're influencing 3 primary subsets of the athlete when we're talking about sports performance and training stimulus interventions. In particular, training affects all of the following: the neurological system, our motor learning, our skill acquisition. These are byproducts of our nervous system and of our brain's ability to learn. Some components of the neurological system that control this are the basal ganglia, the cerebellum and its subdivisions, and the motor cortex. Tissue physiology is also impacted when we have a training intervention, such as the integrity and health of a tissue, the structure of the skeleton, and the amount of muscular development or tissue development. Lastly, cellular metabolism and respiration via conditioning, capillary density, energy utilization and delivery, and energy balance and availability are also impacted by a given training intervention, and considering all of these things is imperative when we think about choosing exercises or choosing training programs. Some types of progressive overstimulus that we can create by manipulating variables can be load, time, frequency, intensity, the range of motion via joint angle or muscle length, the work density that we're doing within a training session, the velocity at which a movement is being executed, the athlete's heart rate and the implement being used, as well as the movement stability via the amount of grounding accessible to the client via their center of mass or their base of support. It's important to remember that intent is going to be the engine of progression of a training program. Intent provides us rationale for our training intervention, a clear direction for the client, and a roadmap for progress. It ensures unification and a forward direction for the goal, the training intervention, and the client's efforts. Within a training program, we have 3 kind of sections of time which we organize in a logical fashion in order to create progress, these being the macrocycle or the long-term training plan, the mesocycle, the midterm training plan, and the microcycle, which offers us a granular view of the training week or a section within the mesocycle. The coach's duty is to determine the organizations of these priorities and to make them logical and progressible within the macro, meso, and micro cycles. Here's an example training week. You can see where data was collected, where notes were made over time. And we can also see at the top how we have an organization within the given week of the intent and the training stimulus goal. So here we have, Monday squat day, Tuesday bench day, and the things that we're going to do for martial arts training, as well as the things that the client might do for recovery. Lastly, it's important to remember to stick to the plan. Sometimes modification is necessary in the advent of illness, injury, or travel and equipment access changes, but it is important to always remember that the intent of stimulus should always be pursued. So if we're altering an exercise or changing something via access of what we have available to us, it's important to keep that intent paramount. So for example, if we have quad hypertrophy as a stimulus and somebody doesn't have a leg extension machine, perhaps they can sub with a banded leg extension or a sissy squat or even a quad fallout, depending on what they have access to and how strong they are relative to their body weight. Excessive and reactionary drops in training stimulus can be very detrimental. So it can be tempting when we feel, kind of a wiggle or an ache or a pain or a little under the weather or fatigued just from hard training, to really reactionarily drop or skip training. And often I think that this makes us more vulnerable to getting hurt and, more vulnerable to losing progress than if we were to train around or, train through at a reduced intensity, whatever it is that we're experiencing. It's important to remember that nobody feels 100% when pursuing high performance. It's not uncommon during a training program, in particular during a peaking phase, to feel slightly a little less energetic, a little achy, et cetera, a little subpar, and that some small amount of that is a normal part of pursuing high performance, and it's up to the coach and the athlete both to determine if that's excessive or if that warrants sticking to the plan. But oftentimes, simply not feeling 100% isn't an excuse to not train or to skip.